We are live now, doctor.
Okay. So, good evening, postgraduates. Welcome to this Pan India Intercollegiate quiz. Today is the finals. Okay. Let's. So, Brain Teasers in association with Ophthalmological Society of Nagpur presents the Big Q, which is a Pan India Intercollegiate quiz for postgraduates. So this is our
आठ
single.
समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं
तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
Like that. Yeah. So good evening once more to all my friends, postgraduates friends, and my pranam to all the mentors. Brain Teaser Teams welcomes you all to this final of the fourth season of Big Q. As we are all aware, Brain Teaser is an online platform for hosting quiz for ophthalmologists of our country since last 6 seasons, or I should say years. It was 3 years back for the first time we initiated an all India exclusive quiz for postgraduate with a single aim of getting postgraduates from across the country on a single platform. We had last 2 seasons very successful, and the third season of which the finals we are hosting today has also been quite amazingly well supported. I'm really thankful to Ophthalmological Society of Nagpur, the president and the secretary for associating with this association with Brain Teasers for being a part of Big Q. The fourth season had 6 preliminary rounds, 4 quarterfinal rounds, 2 semifinals, and finally today we are with the 15th episode, that is the finals. This was aired on every alternate Wednesday since last 4 months. Brain Teaser is extremely thankful to the team of quiz masters who really toil hard to create such a wonderful experience of learning with fun. In today's final, we have 4 quiz masters, and all of them have been associated with us since last few seasons. Dr. Annapurna Kumar, who is currently working as a postgraduate teacher at Arvindaya Hospital, Pondicherry. Dr. Dipti Joshi, who is a pediatric ophthalmologist at MM Joshi Eye Institute, Hubli. Dr. Rashmi Gandhi, who is a consultant neuro-ophthalmologist from Center of Sight, Hyderabad, and also a dear friend of mine. And of course, Dr. Uma Kulkarni, who is the professor of ophthalmology at Enopoya Medical College. This particular season, we are thankful to His Highness team because they have been associated for supporting us financially. My sincere most gratitude to Mr. Surenarayanan, Mr. Naresh, Mr. Kaustu for their support and helping us start this third season. I would also fail in my duties if I don't acknowledge the field force of His Highness, who made such a massive effort to enroll more than 320 teams from across the country from various colleges. As always, the Numerotech team headed by Mr. Sai and his team has been actively with us since last 6 seasons, and they are responsible for smooth and flawless execution of this Brain Teaser platform, and we are indebted to them. Now, without much ado, let me request my co-host and Dr. Shilpi Navre to familiarize you all with the rules of the game for the finals. Over to you, Shilpi.
Thank you, sir. So, postgraduates, welcome back. Today is the finale of this fourth season. So, let me take the privilege of introducing our quiz masters. So, our first quiz master is Dr. Annapurna ma'am. She is a former professor of ophthalmology and currently a PG teacher at Arvind Eye Hospital, Pondicherry. She is the creator of YouTube channel AP's Ophthalmology Pearls with more than 38,000 subscribers and more than 330 videos with 2 million views and daily quizzes for the past 3 years, subtitled in 16 languages. She is proficient in PowerPoint and provides professional medical PowerPoint design and video editing services. Welcome, ma'am. Our second quiz master is Dr. Deepthi Joshi. She is pediatric ophthalmologist at Joshi Eye Institute, Hubli. She is actively involved in PG teaching for past 8 years. She is the recipient of Best Squint Paper Award at AIOS and Best Squint Video at World Society of Pediatric Ophthalmology and Strabismus. She has multiple publications to her credit in various national and international peer-reviewed journals. Beyond ophthalmology, she is enrolled in Limca Book of World Records for training maximum teachers at a stretch about safeguarding children against child sexual abuse. Welcome, Dr. Deepthi. Our third quizmaster is Dr. Rashmin Gandhi, sir. He is a consultant neuro-ophthalmologist at Center of Sight, Hyderabad. He is director of Exxon Medtech Private Limited, director at Foresight Worldwide and Cygnus LLC UAE. He is a country director, India, and principal researcher, Davos Alzheimer's Collaborative, a World Economic Forum initiative. He is a research scholar, IIT from Hyderabad, research scholar and clinical coordinator, Brain Center, Indian Institute of Technology, Madras, and formerly he was a board member and director of the Shankara Netralaya Academy. Welcome you, sir. Our last quizmaster is Dr. Uma Kulkarni, ma'am. She has a teaching experience of approximately 24 years, all in Yenopoa. She has publication to her credit as a textbook of Essentials of Ophthalmology and more than 30 index publication. Her interest beyond ophthalmology is photography, birding, and poetry. She is also a in Research Ethics Committee. She is the 10 times PG Quiz Master at COSCON, 17 times PG Quiz Master at Dakshina Kannada level, and 3 times Big Q Quiz Master. She has won the awards of Outstanding Teacher Award at Forum of Ophthalmic Teachers in India 2024, Best Teacher Award at Yenepoa in 2018, and Best Researcher Award at Yenepoa in 2025. Welcome you, ma'am. So with this, these are the prizes for you, the postgraduates in today's finale. The winners will get 50,000 rupees cash. The runner-ups will get, the first runner-up will get 30,000. The third rank holder will get 20,000, followed by 15,000, 10,000, and 5,000 rupees respectively. So there is a gift hampers for all the teams from team 7 to 10. And all the quiz masters of the first 6 winning teams will get a cash prize of rupees 15,000 and gift hampers for all the mentors from team 7 to 10. For audience, yes, we have prizes for in this finals also. So all the audience, there are 3 prizes for the audiences in this round. So let's see what is the format of the quiz for the finale. So yes, as always, teams have to log in from 2 platforms, that is Kahoot and Zoom. You need to log in from 2 devices, but only 1 email ID. The first screen is the live quizzing, which will happen only on the Zoom platform. And 3 out of 4 rounds will happen only on the Zoom platform face to face with the quiz masters, and this is only for the teams. While the second screen is the Kahoot platform for MCQ round, which has to be played by both the audience and the teams. I request all the mentors to log in from separate screen only on the Zoom platform. So in MCQs, in each set, you will have 5 questions to be played by both the teams and the audiences. There will be no negative marking in this round. While the rapid fire round, only for the teams, you will have to answer 5 questions in 30 seconds time. For every correct response, plus 10 marks. For incorrect, minus 5. So if you don't know the answer, just say pass. In image and case-based round also, it is only for the teams. You'll have to answer 3 questions in 30 seconds time. For every correct response, plus 10. For incorrect, it is minus 5. And the new round is the crossword or the subspecialty round. It is also only for the teens. In this, you'll have to answer 4 questions in 30 seconds time. But yes, there is no negative marking in this round. So without wasting more time, I request our first quiz master, Dr. Deepthi Joshi, to please take over.
Good evening, everyone. So we will begin with the MCQ round, the first round. Each of the MCQ have got 4 options. So here beginning with our first question now. So you decide to conduct a study whether smoking is a risk factor for ARMD or not. And you identify 2 sets of patients with ARMD and those without ARMD, and then you determine their smoking history. Now, what type of study does this scenario best describe? Is it cohort study? Is it B, single mass study? Is it C, case control study? Or is it D, a double blind study? So what type of study am I talking about? So the answer for this question is, it's a case control study. The question itself says there is a set of people who are case, which are ARMD, a set of people who are control without ARMD. So it is an observational type of study. So it fits into the case control study. So the answer was case control study. Coming to the second question now. Which one of the following statement about the adult orbit is false? So which is false? The options: first, the volume of the orbit is 30 ml. B, the maximum width is 1 centimeter behind the anterior orbital margin. C, the depth of the orbit is about 50 millimeter from the orbital entrance to the apex. D, the medial walls are parallel and the border of the nasal cavity, ethmoid air cells and sphenoid sinus posteriorly. So which is false? So the correct answer is, the depth of the orbit is 50 millimeter. It's actually 40 to 45. Why is it important to know? This is basically because whenever you are doing any orbitotomy for any orbital tumor, the depth exactly where it is sitting, at what depth you should be entering. So that's very important. The depth is 40 to 45 millimeter. Rest of them are correct. It is about 30 ml, and then the 1 millimeter behind is the maximum depth, and it is parallel, the medial wall. So all these forms correct. The third question, which of the following structure are responsible for this clinical presentation? Look at the photo and the options are, is it periocular skin and palpebral conjunctiva? Is it palpebral conjunctiva and tarsal plate? Is it orbicularis oculi and tarsal plate? Or is it periocular skin and orbicularis oculi? Your time starts now. So the correct answer is periocular skin and orbicularis oculi. This is a case of epiblepharon. So in epiblepharon, there is an extra fold of skin and orbicularis oculi. Normally in children, it is seen. It usually resolves by itself. We just give them some lubricants for the trichiasis effect caused by it. In case of very severe non-resolving cases, surgery will be done. So the next question is, which one of the following is found in the inner plexiform layer? Is it axons of ganglion cell? Is it axons of amacrine cell? Is it synapses of the photoreceptor? Is it footplate of the Muller cells? And your time starts now. So the answer is axons of amacrine cell and the dendrites of ganglion cells. We were talking about the inner plexiform layer. The outer plexiform layer is horizontal cells, bipolar cells, and photoreceptors. So the next question, the last question of this set, how many degrees is the fovea displaced from the optic nerve? Options are 15 degree, 23 degree, 10 degree, or 6 degree. And the time starts now. And the answer is 15 degree. This is very important, basically because you find out the blind spot on the visual field based on this. So it's 15 degree horizontal. To be exactly, it is 15 horizontal and 1.5 degree. You can remember both as 1.5. So 15 degree horizontal, 1.5 degree downwards. And that is the difference between fovea and the optic disc. So this is the blind spot visualization on the visual field. So with this, I wrap up the first set of MCQs.
Thank you. Thank you, Dr. Dipti. So with this, we start with our first case-based round. Okay, so this is a spin wheel. We'll just spin it. It's from 1 to 10. So wherever it will stop, that team will get the option to choose the sets which they want to play. So teams, hope all of you are ready. So let's start. So first is team 6. Team 6. Eye catchers team.
Yes, ma'am.
Uh,
Yes, ma'am.
yes, be closer to the mic.
Case based, ma'am.
Yes. So kindly introduce yourself.
Case
Case
based
based,
set.
ma'am.
Okay, first introduce
Good evening,
yourself.
all. I'm Dr. Aishwarya. Good evening, everyone. I'm Dr. Aishwarya, final year from Yenagoa Medical College.
Dr. Safidin, final year from Yen World Medical.
Your voice is breaking. Be closer to the mic. Team
Yes,
I.
ma'am.
Yes, ma'am.
Yeah. Okay. So which set you want?
Are we audible, ma'am?
Yes, you are audible.
Case based set, ma'am.
Yes. Which set?
Case based.
I know case based. Which set you want? Set number.
Set 7, ma'am.
Okay. Set 7.
7, ma'am.
Annapurna ma'am?
Yeah. So, I will be presenting to you a case scenario, okay? And I'll give you a few seconds to absorb and, process the information. And then you will get exactly 30 seconds and 3 questions. In order to prevent any distraction, I will not be reading out the question. You read it and process it yourselves, okay? And the questions will appear one by one.
Okay.
And either you answer or you say pass, and only then will the next question come up on your screens. So if you're ready, Shilpi, we can start.
Yes, ma'am. Yes, ma'am. So shall we start?
We are ready, ma'am.
Okay.
Yes, ma'am.
So a 35-year-old woman presents with a 4-month progressive painless diminution of vision and occasional floaters in the left eye with no other significant history, pain, redness, photophobia, nothing. The vision right eye is normal, left eye is 636, pupils are normal, both eyes. IOP is raised only in the left eye, it is 28, fundus is normal. There is a picture of both the right eye and left eye. Then there is a slit lamp picture of the left eye, a gonioscopic picture of the left eye, and a B-scan ultrasonography of the left eye. So have a look. I'll just give you 2-3 seconds. And I think, Shilpi, we can start.
Okay, ma'am.
Next. Next. In Poshner-Coleman syndrome, there won't be any KPs. Next,
There are only
stellate
three.
KPs.
Three.
There won't be any stellate KPs in Poshner-Coleman syndrome.
First
Okay.
answer is Fuchs pyridocyclate.
Okay. So
Okay,
let's see.
first, this is a Fuchs uveitis syndrome. As can be seen, the features suggestive are a unilateral cataract. Okay. And other than the painless diminution of vision, there was no other history. Diminution of vision, elevated intraocular pressure, which is a characteristic feature of Fuchs. There are KPs. You can see the new vessels in the angle, which can bleed leading to Amsel's sign, and occasional vitreous floaters also can be there. So the classic feature in the slit lamp that is absent in Fuchs is the absence of posterior synechiae, and the feature differentiating a Posner-Schlossman from that part you got right. That is, KPs are absent in Posner. Actually, you can get KPs occasionally, but more important is the recurrent episodes of redness, pain with very high intraocular pressure. So they got the third. Which shall we give them, Shilpi?
Ma'am, first is right.
Yeah,
Second, they didn't answer.
they didn't
Uh,
answer.
third one, what do you say?
I think we should give it to them.
We'll give
Got
it to
it,
them.
Alma.
Okay.
Yeah.
Yeah.
Okay.
Just one for the PGs at Porsche Salzman. Yes, you're right. There is no PG, but sometimes it can be asked in MCQ. There can be a single KP, which is called as a sentinel KP.
Thank you so much.
Okay. So
Well
you got
done.
plus 20 from this round. Okay, good.
Well done.
Thank you, ma'am.
Well done.
So now the next team in row is team 4. Team 4.
Hello, ma'am.
Hello.
We'd like to go for the case-based set.
First, introduce yourself.
I'm Vaishnavi. I'm from KMC Mangalore. I'm Dr. Urja from KMC Mangalore.
So which set you want?
Case-based, ma'am. 3, ma'am.
Set number 3. Okay. So ma'am, shall I display?
Yeah, please do.
Okay.
So, a 69-year-old man with a known history of deep vein thrombosis and thrombophilia on oral anticoagulants presented to the emergency department after experiencing loss of vision in the far periphery of his left visual field for the past 6 hours, along with a mild headache. So, vision is essentially normal. Anterior segments were normal, no RAPD. IOP is normal, fundus is normal, CT brain was normal. So you can take 1 or 2 seconds to process the information.
Okay.
Yes,
So
you can present questions.
and your time starts now.
Ma'am, occipital cortex. This is a junctional scotoma, which is sparing the temporal field. Ma'am, Goldman perimetry. Pass, ma'am.
Okay. So let's see what are the answers.
So you're right. It's the anterior most part of the occipital cortex, which subserves a unilateral field. And yes, you got Goldman kinetic perimetry correctly because it's in the extreme periphery. The Humphrey often doesn't show it. And the other field effect is seen a bilateral calcarine lesion, especially involving the superior part in one visual cortex and the inferior part in the other. So they got the first two answers right. So they can get plus 20.
And just to add, I'm sorry, ma'am, lovely question, ma'am. But the third one is also called BMW field because it looks like a BMW car logo.
Okay. So the next team to play is team 1. Team 1. Please unmute
Can you hear
yourself.
us? Oh, sorry. Good evening. I'm Dr. Gahan and this is Dr. Vinayak. We are from Guru Nanak Eye Center, Delhi.
Okay. So are you ready?
Yes, ma'am.
Which case set
Set
you want?
6.
Set 6. Okay.
Okay, so this is a 30-year-old male who presented with sudden onset diplopia of 2 days duration, no predisposing factors, no other significant history. Watch the video carefully.
I know.
So vision is normal in both eyes, anterior segments are normal, no RAPD. So watch the video again carefully.
Right MLF, no? Right MLF. Yes, ma'am.
IOP fundus systemic examination is normal. You can give the questions, Shilpi.
Yes, ma'am.
MRI. Contrast enhanced MRI. Okay. The nystagmus is a type of abducting nystagmus. What is the cause? Next, pass. Next, pass. Ma'am, by closing one eye and checking unilateral.
Okay. Hello?
Yes, ma'am.
Yeah, time is up. You can show the answers. So yes, MRI brain. This is a bilateral internuclear ophthalmoplegia and therefore an MRI brain, preferably with contrast to look for any lesions. And since he's a young person, 30-year-old, the most common is multiple sclerosis. So that those demyelinating lesions may also be seen. And the cause for it is an abducting nystagmus, that's right. But it occurs because of the application of Herring's law, because of the diminished medial rectus activity. The excess innervation also flows to the contralateral lateral rectus, producing this abducting nystagmus. And I think you got the third one wrong. You said close one eye. That's not correct. When you ask the patient to rapidly perform saccades, look to the right, left, then the adduction deficit, if it is not very well seen earlier, it is better appreciated. So the first one, actually only the first one is correct.
And the last is wrong. So it is plus 5.
Yeah.
Okay. Team 9. Team I Ninjas.
Good evening, ma'am.
Good evening.
I'm Chandravadan and he's Saitija. We are from Coimbatore.
Your voice is echoing.
I'm Chandravadan, ma'am.
I'm Saitija, ma'am. We are from Arvind Hospital, Coimbatore.
Okay. So are you ready?
Yes,
ma'am.
Which case you want? Case number?
Set 9, ma'am.
Set 9. Okay.
So, a 4-year-old boy is brought to the ophthalmology clinic by his parents because of a whitish appearance of the left eye. No history of trauma, birth, and development are normal. Examination showed that the right eye of the child was normal, only left eye was involved, and the B scan picture of the left eye is given below. Clinical examination of the parents revealed normal ocular examinations in both of them. The child does not have other siblings. No other distant family members have had any major ocular disease in childhood. So, you can give the questions.
Okay.
Next, ma'am.
Pass. Pass. Continue.
Pass, ma'am.
Okay, time is up. Can we see the answers? So, the history was obvious, it's a retinoblastoma, but the question was which other intraocular tumors show calcification? Choroidal osteoma and astrocytoma is the answer. The risk of unaffected parents of a child with a bilateral retinoblastoma having another child at each conception is about 5%. If it's a unilateral retinoblastoma, same situation, it would be less than 1%. And the germline mutation testing is done on peripheral blood lymphocytes. So, unfortunately, you didn't get anything. So, nothing to your account. Anyway.
Okay. Sure. Team 8.
Hello.
Hello.
Good evening, ma'am. I'm Dr. Samyak. I am from KMC Manipal.
I'm Dr. Anjana from KMC Manipal.
Okay. So, which set you want?
Set 5.
Set 5.
A 40-year-old female presents with slowly progressive diminution of vision in both eyes for 3 months with no other symptoms. Fundus was noted to be normal 6 years back. She is a known case of CA breast on oral medication for 5 years, no other significant history. Vision is 618 both eyes, anterior segments are normal, no RAPD, IOP and fields are normal. So, yeah.
Tamoxifen toxicity. Next.
Night blindness. The third one.
Okay, right. Shilpi, I didn't hear the first answer that they said. What did they say?
They said tamoxifen toxicity. Yes.
So you're right. That is a tamoxifen retinopathy. BAT crystalline dystrophy is basically it's congenital. So in the question it said that fundus was normal 6 months back. So that is the clue that it is unlikely. Moreover, in BAT you also get corneal crystals. And I think we can give you the third one because you said nyctalopia, I think. So that is a feature of cancer-associated retinopathy. So we can give you that. So question 1 and question 3 are correct. Yes.
Okay.
Thank you.
So plus 20 to them. Okay. So now it's time for rapid fire round. So I request Rashmin Gandhi sir. Yes, sir. So shall I start?
Yeah, sure.
Okay, sir. Team 2. Please introduce yourself.
Myself, Dr. Arun. This is my friend Kalyan. We both are from Jipman. Hello.
So which set you want?
This set 2.
Set 2.
Rapid fire.
All right. How are you, Kalyan? How are you, Arun? So basically, you know the rules for rapid fire. You will have enough time, but not enough time. All right. We have tried to keep the questions like just a single word, so not waste too much of time on the question. You have 30 seconds, and as Dr. Shilpi had mentioned, plus 10 minus 5. If you're ready, we can start your time now.
Ready, sir.
All right. What kind of lesion is seen in acanthamoeba keratitis?
Ring-shaped infiltrates.
All right. Question 2. Gold standard test for diagnosing sarcoidosis.
Pass.
Number 3. Most radio-resistant intraocular tumor.
Pass.
Retinal findings in shaken baby syndrome.
Multi-layered hemorrhages.
All right. The tonometer, which utilizes magnetic probe, which is propelled towards the cornea and then rebound back.
Eye care.
Well done. Well done. You got 3 out of 5 right. No negatives. Well done.
Thank you, sir. Biopsy. Okay.
Should be plus 30.
Yes, sir. Yes, sir.
Thank you, sir.
It's again team.
Next time.
Team 10.
Good evening, sir. Good evening, sir.
Good
Sir,
evening.
I'm Dr. Vinisha Fonseca from Sarojini Devi Eye Hospital, Hyderabad.
I'm Dr. Shreya from Sarojini Devi Eye Hospital. Sir.
Oh, from our friendly neighborhood.
Yes.
Okay. So which set you want?
The set 8.
Set 8.
Yes.
Okay. So are you ready?
Yes, ma'am. Yes, ma'am.
Shall we
All
start?
right.
Yes.
So here set comes. Your time starts now, Sarojini Devi. Question 1. Eye movement preserved in internuclear ophthalmic lesion.
Convergence.
Well done. Question 2. Diagnostic tool for corneal endothelial.
Specular microscopy.
Well done. Most common cause for
Thyroid
proptosis in
atrophy.
adults. Gene mutated in an area.
PAC6.
Fluorescent marker used in fundus autofluorescence.
Lipofuscin.
Brilliant. Well done.
Thank you, sir. Thank you, sir.
Shilpi, there is no match fixing. Just because I provided. All right. Well done.
Thank you, sir.
Great. So let's see which next team is in row. Team 7.
Good evening, ma'am. This is Dr. Ahan, and she is my colleague.
Dr. Pooja from Jipma.
We can't see you.
Just
Can you, Oculus experts, can you, yeah. Good to see you, Ahan, Pooja. Yeah.
Hello, sir.
Hi. Which set would you like to go for?
We'll go for set 7, sir.
Set 7? All
Yes.
right. Okay, set 7 coming your way. If you're ready, your time starts now.
Right.
All right. Direction of muscle imbalance in Duane syndrome type 1. Which
Uh,
movement is affected?
The abduction deficit. Next.
Question 2. Predominant ocular sign in Marfan syndrome.
Supratemporal dislocation of lens, ectopia
Question
lentis.
3. It's all right. It's all right. Organism causing hordeolum.
Propionibacterium acne. Next.
Question 4. Classic sign in ocular ischemic syndrome.
Optic disc collaterals. Next.
All right. Right. We'll go for this.
Yes.
Retinal layer where hard exudates accumulate.
Outer plexiform layer.
Well done. Well done.
Thank you.
So only question 3, you got it wrong. It's not propionibacterium, it's Staphylococcus. Ocular ischemic syndrome, though we had kept rubiosis here, but I'll give it to you.
Thank you, sir.
Plus 35
right.
to the.
Yes, 1 minus 7. Yeah. Well done.
Thank you.
So let's see which team is next. Team 4.
Hello, ma'am. I'm Vaishnavi. I'm Urcha from KMC Manipur.
Welcome back again.
Welcome back here.
Set 3.
Set 3, is it?
Yes.
All right. So set 3, if you are ready, we
Yes.
start your time now. Most common ocular sign of myasthenia gravis.
Ptosis.
Common cause of keratitis in contact lens wearers.
Pseudomonas.
Wavelength used in photodynamic therapy. You
Pass.
can tell me color also. Okay. Drugs causing vertex keratopathy.
Amiodarone.
Sorry?
Amiodarone.
Key sign in optic neuritis. Objective sign in optic neuritis.
RAPD. With
Well
optic
done.
disc edema.
RAPD is fine.
You want to attempt third question?
810.
Okay.
Okay, it's all right. Drug causing, what did you say for number 4?
Amiodarone.
Yes.
All right. Well done. Well done.
Correct. Okay. Good.
I think next time should be you have to give only 20 seconds. These are too much. Very good.
Yes. So let's see. The next team in row is team 3. Please introduce yourself.
Good evening, sir. Good evening, all. I am Dr. Gaurav.
Hello, good evening all, and I'm Dr. Samvada. We're from IMSPH.
So which
Which
set?
Set 5, sir.
Set 5?
Yes, sir.
All right. So here we have set number 5. If you're ready, we'll start your timer now. Origin of sympathetic fibers to the eye.
Hypothalamus.
Inheritance pattern of LHON.
Pass.
Fluorescent stain color under cobalt blue
Green.
light. First line of drug in Toxoplasma retinochoroiditis.
Pass.
Okay. Most common ocular manifestation of rheumatoid arthritis.
Scleritis.
Is
Or,
that LHON is mitochondrial?
I know, but I cannot give it to you now. But you're right. You're absolutely right. It is a mitochondrial inheritance. So hypothalamus, you got it right. Lebers, you passed. Fluorescent, you got it. Green, you got it right. Pyrimethamine, you passed. And RA, actually, it is dry eye and not scleritis.
So it's
So we would have to give minus in question number 5. Yeah.
so plus 10 for first, plus 10 for third one, and minus 5 for the fifth one. So it's plus 20, plus 15.
Yes. Well played, BHU.
Okay. So, sir, we are through with the 5 teams. Now it's time for subspecialty round or the crossword round. Uma ma'am?
Yes, I'm here.
Yes. So you want to explain this, na? First, this question?
Yes.
Okay,
Yes.
ma'am.
So thank you so much, the team. And the questions will be like this. There's a crossword. Can we go to the next slide to show? There's a crossword here. You can see there are 4 words. One word is written in the black background. One is in the blue background. One is in the orange and one is in the green. The clues will also come in the same background. So you have to match the colors and answer. In case you have color deficiency, let us know. So can we have the questions?
Yes, ma'am.
Yes. So this goes like this. There's a blue. The nerve which causes tearing is here. Can you try to take a guess? It's lacrimal. The nerve shared by the nose and the eye, that's a green. So it is here, nasociliary. The largest branch of the ophthalmic division of the 5th nerve, this is orange, that is frontal nerve. And the last one, the cranial nerve, often spelled wrongly with 2 C's, is the oculomotor nerve. It goes like this. So the clue that in case you know the answer, don't look at the crossword, just answer it. But look at these alphabets which are overlapping and which are already seen. So that can give you a clue what is the answer. Yeah, with that, I'm ready. I hope the students are also ready.
And yes, remember, there is a good news that there is no negative marking in this round.
Yes.
So you can attempt. Okay.
Yes. Plus 10 and give one answer. One first answer will be taken into consideration. Okay. Okay. You have only 30 seconds.
Yes. So let's start. Ma'am, whenever you will say stop, I'll stop the spin.
Or you can stop anytime. No problem.
Okay. Okay.
Yeah.
So again, team 8.
Yes. Team 8.
Are you ready?
Yes.
Okay. Which set you want?
Set 3.
Set 3.
3. Oh.
Okay. Okay. So these are the questions for you. Yes, these are the 4 words. The first one is involuntary contraction of muscles as in Marcus syndrome. Second is antifungal drug used intrastromal corneal injections. Green word. Patterns of cell arrangement, mammal cell carcinoma. Blue word. And what does A stand for? MLPA. Quick.
Voriconazole for the green one.
Okay. Yes, voriconazole. Anything else? Try out. Okay.
Parasitoid for...
Okay, no. Okay, that's not right. You get 10 points. Voriconazole is right. The first one is synkinesis. Okay, orange word. The blue word is palisades and A stands for amplification. So first team to face any new sort of question will always be under stress. I think it will be easier for the next teams. Okay. So they get 10 points. Yes.
Team 3.
Okay. Yes, team 3.
Yes, ma'am.
So which set you want?
Set 7.
Okay.
Okay. Are you ready?
Yes, ma'am.
Okay. Chalo. So these are your 4 words. The clues are a type of cataract located in the fetal nucleus.
Zonular.
Okay. Monoclonal antibody used in the treatment of refractory uveitis. It's very
Infliximab.
clear. Very good. syndrome associated with left lateral rectus palsy and facial pain following otorrhea.
Pass.
And the last one, which infection is associated with owl's eye appearance in the corneal endothelium?
Pass.
Okay. So the type of cataract is sutural cataract. Infliximab, you got it right. Grady-Negro syndrome is the next. And the last one is cytomegalovirus with owl's eye appearance in the corneal. So they also get 10 points.
Yes.
There's no negative points, so you did not lose any points for the zonular answer.
Okay.
Okay, well done. Next team.
Team 3. Okay. Team 6.
Okay, team 6.
Good evening, ma'am.
Yeah. So my college team, but I have to declare here that I have not been training them for the last few days for the preparation of this quiz. And all the best to you.
Thank you. So which set you want?
Set 1, ma'am.
Set 1.
Be closer to the
One.
mic.
Yeah, be close to the mic. Yes.
Yes, ma'am.
So these are your 4 questions. First, monitor ocular movements in automated perimetry. What is it called? Tonic, fusional, proximal are types of what?
Convergence.
Configuration of conjunctival vessel seen in raised episcleral venous pressure. What is it?
Corkscrew acid. Corkscrew.
Last one, post-operative symptom often described as positive and negative in a pseudophakic eye. Any answers? No. Okay. So that was gaze tracking. Yes. And
Yeah, ma'am.
yes, you guessed that. And the last one, any guesses? Dysphotopsia. So they get 20 points.
Dysphotopsia.
Yeah, dysphotopsia. So 20 points there. We get to the next team.
Thank you, ma'am.
Well done.
Team 2.
Okay. Yes, Puducherry team. Okay. Are you ready?
Yes, ma'am.
Yes.
Set 2, ma'am.
Set 2. Okay.
Team 2, set 2.
Yes, set 2.
First,
Yes, these are your 4 words. In which ophthalmic surgery is the complication pulled into seen? Eye with axial hypermetropia and thickened sclera.
Nanophthalmos. Green nanophthalmos.
Yes. Prone and muriatic tests are grouped under what tests for glaucoma? And the last one, a juvenile condition characterized by Taunton gland. Yes, provocative is right. Last one, Taunton giant cells. Okay. Okay. Okay, the time is up. The first one was strabismus. That is where the muscle can tear and you can have a pulled in syndrome seen. And anophthalmos, you got it right. Provocative, you got it right. And the last one is xanthogranuloma, which you did not get. So again, 20 points here. Well done.
Thank you, ma'am.
Yeah.
So the next team to play is Team 10.
Okay, team 10.
Good evening, ma'am.
Good evening. Are you ready?
Yes, ma'am.
Yes. Smile then.
Set 8.
8. Okay. Okay, we start. Okay, these are your 4 words. What is fashioned using femtosecond in an out to in and in out manner in smile?
Pass.
Second one method of strengthening muscle in
Plication.
squints.
Plication.
Plication is right. What does O stand for in top algorithm in glaucoma?
Pass.
Okay, last one. A description of keratopathy following nitarsudil eye drops. Quick.
Punctate.
Punctate is not correct. There's no negative, so you can always try out. The first one is very simple. It's lenticule fashion. Okay, and you got plication very correct. O stands for oriented, target oriented perimetry. And last one is description is honeycomb. So this has been making rounds everywhere, that honeycomb corneas. So they get 10 points here. Well done.
Thank you, ma'am.
So with this, we end with the 5 sets of crossword round also. And now it's time for the second set of MCQ. So Dr. Deepthi, please.
So hello everyone. Hello, welcome back. Now we would go to the second set of MCQs. So let's begin with the first question of this second set. The uvea is attached at all of the following sites except its basic anatomy. The options are ora serrata, vortex veins, scleral spur, long posterior ciliary artery. So where is it not attached? Okay, so the answer is ora serrata. This attachment is very important. So basically when you see on the B scan, how do you differentiate between RD and CD, and that's RD gets restricted at the ora serrata because the retina is attached at ora serrata and the optic nerve, and the uvea is attached everywhere, and that's how the choroidal detachment actually proceeds further, and that is optic nerve, scleral spur, vortex vein, long and short posterior ciliary artery. So all these places the uvea is attached. So the next question is, so a phakic patient undergoes a vitrectomy with replacement of his vitreous fluid with silicone oil. Now, how does his refractive prescription change? The options: does he become a myope? Is there a hyperopic shift? No significant change in refraction, almost the same, or cannot be determined with the given information. You need some other information to determine. So now your time starts. So the answer is there is a hyperopic shift. So whenever you replace the vitreous fluid with that of a silicone oil, there can be a shift in hyperopia. Sometimes, mostly it's by 5 to 9, but then sometimes even as great as 14-15 diopters. So in case of phakic, they become more hyperopic. In case of aphakic, they become less hyperopic. But then hyperopic change is what is noted when silicone oil is replacing the vitreous. The third question is, so you use a duochrome test to refine the refraction of a patient. Now the patient says that red color is better, it's more clear than the green color retus. So what does this mean? Red is better than green. So is he over plussed? Is he over minused? He is anisometropic between the two eyes? Or is he astigmatic? When is the red better? Your time starts now. So the answer is he is overplus. Remember the mnemonic RAM gap. RAM is red add minus. So they are overplus. You have to add minus. Gap is green add plus. They are over minus. You need to add the plus to them. So that's how RAM gap. If you don't understand too much of physics, what I have put over there, just remember this mnemonic. I think most of the things will become easier for you to suddenly answer in the exams. So the next Which optical instrument provides an inverted and reversed image on the retina? The options are, is it direct ophthalmoscope? Is it indirect ophthalmoscope with a 20D lens? Is it a ruby lens and the slit lamp? Goldman contact lens and a slit lamp. So inverted and a reversed image. And the time starts now. So this is the most easiest question in this whole series. It's an indirect ophthalmoscope. Left and right, we do it in our OPD. And we know that if we see something above, we need to draw it in our retinal diagrams below. If you see something to the right, you draw it to the left. So there is both inversion as well as reversal. So the answer is indirect ophthalmoscope with 20D. Baki sab pata bhi nahi hai, so you can just take indirect. I assumed that all of us do indirect and we know this answer. So the next question, the last question of this set. A patient has a red Maddox rod with the cylinders oriented horizontally in front of her left eye. So Maddox rod, horizontal orientation of the cylinder in front of the left eye. Now what will she see when you shine a torchlight in front of her? So the options, first is right eye, next is left eye. So is it a red light and a horizontal white line? Is it a red light and a vertical white line? Is it a white light and a horizontal red line? Or is it a white light and a vertical red line? So your time starts now. So the option, it's D, white light. So in front of the right eye, there is no Maddox rod. So she will directly see the white light. In front of the left eye, the Maddox rod is kept as horizontally placed cylinders. So you actually see a virtual image which is perpendicular. So you will see a vertical red line, and that is how you would be seeing a white light, white spotlight in the right eye and a vertical red light in front of the left eye, because your Maddox rod is actually red color cylinders. So with this, we wrap up the second round of MCQs.
Thank you. Thank you, Dr. Deepti. So now this is time for a short commercial break. We are thankful to the His Highness team for sponsoring this season of. So now it's time for a case-based set again. So Annapurna ma'am.
Yeah.
So let's see which team. It's team 9 has already played. Team 3. Team 3.
Yes, ma'am. Are we
Yes, ma'am.
audible?
Yes. So you want which set?
Set 1.
Set 1. Okay. So
Yeah.
shall I?
Yeah,
Yes.
yeah. So this is a 30-year-old weightlifter with no other systemic disease and gives a one-day history of acute diminution of vision in the left eye in the middle of a weightlifting competition. No other predisposing factors, other eye is normal, all lab reports are normal. On examination, the involved eye has a vision of 2/60, anterior segment is normal, no RAPD, intraocular pressure is normal. I'll just give you 1 to 2 seconds to process the fundus picture and the OCT picture. So yeah, you can go ahead with the questions.
Condition associated with the sign of the same. Valsalva.
Sir, also.
Turser syndrome has associated intracranial hemorrhage. Rapid visual YAG hyalotomy.
Want to attempt the first?
Hyalotomy. Valsalva movement.
Don't know which.
Yeah, it is a Valsalva retinopathy, but the question was not that. Which other ocular condition is associated with what is the sign that you see in the fundus in this Valsalva retinopathy? So this is there is a combination of a subhyaloid and a subhyalum hemorrhage. So this is called a double ring sign, right? And this not the same sign, but a sign of the same name is also seen in optic nerve hypoplasia. So that is the question that was expected. And yes, the second one you got it right. Tursin is associated with intracranial hemorrhages, so that you can get it. The last one also you got it, laser hyaloidotomy or membranotomy. So 2 questions you get right.
Yes. So plus 20 to them from this round.
Yeah, good.
Thank you.
Thank you.
Team 6 have already played. Team 7.
Hello, ma'am.
Hello. So which set you want?
We'll go for set 8, ma'am.
Set 8. Okay.
Okay. So a 30-year-old male presented with a 1-week history of pain and diminished vision in both eyes for 1 week. He underwent bilateral LASIK 6 weeks back and had been on Tobra and dexamethasone ever since. Vision is 4/60, 2/60. IOP in the right eye is 8, left eye is 4 by Goldman applanation tonometry. You have a look at the both eyes present the same picture. So I'm showing only a picture of the left eye gross appearance, left eye slit lamp, and left eye OCT. Just take 1 or 2 seconds to process this information. Yeah, you may show the questions.
Next. This is probably lamellar keratitis diagnosis. IOP can be estimated by devices like ocular response analyzer or Corvis ST, and clinical features wise, DLK versus PISK can be seen in terms of the interface is the only region involved in DLK, whereas PISK can be above and below also.
Okay, can we see the answers? So this is a common mistake. DLK has to, it's a very important to differentiate between DLK and PISK simply because DLK responds to steroids, whereas steroids can worsen pressure-induced stromal keratitis. You notice that DLK appears early, okay? It appears within 2 to 5 days and the IOP is usually normal. The peripheral IOP is normal. Whereas in a PISKC, he has been 6 weeks on steroids. So this is most likely to be a PISK. Why is the IOP showing 8 and 4? That is because it was taken by the standard method. If you take a central pressure measurement because of the fluid in the interface, you get a wrong value. You have to check a peripheral IOP measurement, usually either with a tonopen or if you have it, a dynamic contour tonometry. So actually, none of their answers were right.
Okay.
Yeah.
So it's minus 15 for them from this round. So the next team is Team 3 already done. Team 6 done. Team 10.
Yes, ma'am.
So which set you want?
Set 10.
Set 10. Okay.
So a 7-year-old boy presented with drooping of the left eye since birth and squint. Visual acuity, visual acuity in the right eye is normal. Anterior and posterior segments are normal. Left eye has a diminished visual acuity. I'll give you a couple of seconds to process the 9 gaze. You have to look at it carefully because all your questions are based on this image. Okay.
Left eye MED with amblyopia. This is in all elevation, abduction, elevation restriction in all 3 cases. In Brown's only adduction. Next, IR restriction. Superior rectus paralysis.
Can we have the answer? Shilpi, I didn't hear what they said the first. What is the most likely diagnosis? What did they say?
Left eye MED with amblyopia, ma'am.
Sorry?
Ma'am, they answered. It's more, they answered it.
Oh, they answered it. Okay, okay. Right. So, yes, it's a monocular elevation deficiency. Yeah, the second answer was also correct. In Brown, the elevation deficiency is only in adduction, whereas in monocular, it is there in all 3 gazes. In addition, ptosis or pseudotosis and poor Bell's phenomenon are seen only in monocular elevation deficiency. And the third one, they got 2 out of the 3 right, so we can give them that. So, yeah, good, well done.
Thank you, ma'am.
Yeah.
Okay, so only 2 teams remaining. So it's team 5.
Ma'am, good evening, ma'am.
Yeah. Be closer to the mic and please introduce yourself.
I'm Dr. Krutin from Arvind Eye Hospital, Coimbatore, second year. I'm Dr. Abhishek Ji Nair from Arvind Eye Hospital, Coimbatore.
Okay. So which set you want?
Set 11.
Set 11. Okay.
So a 66-year-old woman underwent uneventful phacoemulsification with PCIOL in the right eye. On the first post-operative day, she complains of blurred vision and mild discomfort, but no significant pain. Visual acuity is 636, intraocular pressure is 40. Have a look at the anterior segment photograph. Have a look at the ultrasound. I'll give you 1 to 2 seconds to process this information.
Yes, ma'am.
Yeah, you can show the questions.
TAS, Irwin-Gard syndrome. Toxic anal segment syndrome. Limbus to limbus corneal edema. Greenish discharge, severe corneal edema, severe vitritis.
Okay, so good. You got all your answers right. So yes, this is a TAS and limbus to limbus corneal edema. Probably I'll still give you the points, but I would have preferred it if you said severe pain, because according to the EVS, the symptom with the maximum more than 90% of people did complain of pain in acute post-op infectious endophthalmitis, but very good. Well done.
Thank you, ma'am. Thank you.
Only the 1 team is remaining, that is team 2. for this case-based round.
Hello, ma'am.
Yes. So you are left with 2 sets. Which set you want?
Set 2.
Set 2. Okay.
A 35-year-old female gives a 3-month history of intermittent attacks of pain and blurred vision in the left eye, for which she underwent bilateral laser peripheral iridotomy 2 weeks back. She now presents with acute onset pain, redness, photophobia, and diminished vision in that eye. Other eye is normal. This eye, 660 vision, AC is shallow, pupil dilated, non-reacting, and intraocular pressure is 40. Bilaterally, the iridotomies are patent. So I'll give you a few seconds to process the picture. Okay, you can give the questions.
Plateau iris. Malignant glaucoma, despite patent PI, the IOP won't endorse. Next question. Next question.
Okay, can we have the answers?
Yes, ma'am.
So yes, you're right. It is a plateau iris syndrome. You can see the plateau iris configuration. Your second answer, unfortunately, was wrong because even in a plateau iris, in spite of the iridotomy, the pressure can be high. So the main difference is a uniformly shallow AC in malignant glaucoma, in addition with a forward movement of the iris lens diaphragm and on gonioscopy, a double hump sign. The third answer is iris and ciliary body cysts, which can very closely resemble plateau iris. In fact, it's called pseudo plateau iris. And the cysts are large enough, and you look carefully with a slit lamp, you can see the bumpy appearance of the iris. So one is right, so plus 10. Second is wrong, so minus 5. No, actually, second, I don't think we should. I don't know.
Okay.
Should we cut marks? I don't think it's required to cut.
Okay, ma'am. Then
Just
we'll
give them plus 10 and yeah, that's all.
plus 10. Okay, ma'am. Thank you so much. So with this, we end with the case-based round. And now it's time for the rapid fire set for the rest of the 5 teams. Oh, Rashmin, sir?
Let's spin the wheel. Yeah.
Yes, sir. Team 6.
Good evening, sir.
Good evening, sir.
Hi, good evening. How are you?
We are good, sir.
Great. Choose your set.
Set number 11, sir.
Set number 11. Well done. Very brave. Generally, we avoid the first and the last. Well done. All right. So if you are ready, we will start your time now. All right. Enzyme absent in mucopolysaccharides 1 causing corneal clouding.
Next.
Next, please. Main protein of lens capsule.
Next.
All right. Typical
Crystalline
defect in AI.
proteins or crystallines.
Typical defect in AI and visual field.
Altitudinal field defect. Next.
Well done. Most sensitive layer to hypoxia and retina.
Next.
All right. Precursor lesion to OSSN.
CIN.
Well done. Very well done. Now I would like to give you some bonus mark. I can't, but very well done. Excellent. Excellent. Yeah, I know this was little tough, but you did very well. Congratulations.
Done.
Well done.
So plus 20 to them, sir?
Plus 20 to them.
Okay, sir.
Thank you.
Team 1.
Good evening, sir.
Good evening, sir.
Hi. Hi, Mamsi boys.
Set 1.
Say, All right. So, boys, if you're ready, let's start your clock now. Most common primary intraocular malignancy in adults.
Choroidal melanoma.
Protein mutated in autosomal dominant best
Dystrophin.
Histopathologic hallmark of fictinial conjunctivitis.
Pass.
Granulomas.
Vitamin A deficiency. 4.
Okay. Zone of contact. Which layer is affected in VKH disease?
Brooks membrane, sir.
Subarp.
All right. Okay. Melanoma. Bestrophin was a good catch. Very well done. Granuloma, you didn't say it. Vitamin A is fine.
No.
Yeah, relax. Don't fall down. Yeah, okay. We will. All right. And subarachnoid Brooks membrane, I don't think we can give it to you. It was very specific choroidal layer. We'll leave it at that. Maybe we'll not give negative, but we'll not give any positive as well. So 4, well done.
So
Well
plus
done, very
40.
well done. Plus
Okay.
40, yes. Brilliantly done.
So the next team Team 5.
Have they already done it?
Good evening, sir. Good evening.
Hi.
Good evening, sir.
So
Good evening, sir.
which
Yes.
set you want? Team 5?
It's a dude.
Set 4.
Set 4. All right. Okay, boys, if you're ready, A-stigmates, your time starts now. Primary site of aqueous production.
Non-pigmented epithelium. Trabecular mission.
Structure affected in Aedes
Ciliary
tubule.
ganglion.
And classic fundus finding in toxoplasmosis.
Headlight in fog.
All right. Test for detecting early glaucoma. I would say the most sensitive test for glaucoma. Let me change it because it's a little controversial.
Next.
Okay. Number 5. Hallmark feature of Coats disease.
Exudation. Telangiectasia.
Exudation. Fine. Perfect. We give all 5. I mean, scar was late, but we have not mentioned here scar. So headlight in fog, we will give it to them.
Sir, what about the fourth answer they gave? I mean, I couldn't hear that.
Field we said.
Yes. They give. Again,
Okay.
because the wording was bad. So they said OCT, which is also right. And then they said field. So that's right.
Okay.
They gave everything. Lovely.
Plus
We had 2
50.
options here for Coats disease and you said both. Yeah, all 5.
Thank you, ma'am. Thank you, sir.
So team 5 is done. So now we are remaining with the
2 teams,
3
8 and 9.
8. 2 teams, yes.
8 and 9, and we have options.
9.
Hello, sir. Hi, sir.
Hi. Good evening.
Which set?
Which set?
Set 6, sir.
Set 6. Okay. All right. So here comes your set. Eye ninjas. The time starts now. Angle structure seen first on gonioscope.
12 baseline.
Key histological feature of vernal keratoconjunctivitis.
Pass.
Okay. Most sensitive imaging for optic nerve glioma.
MRI.
Okay. Location of Elschning spots.
Fundus.
Oh, yeah. Nerve supplying orbicularis oculi.
7th location.
Well done.
Key histological feature. Eosinophils.
Well done. Brilliant. Very well done. Eye ninjas. Like ninjas, you are true to your form. Well done. All 5.
Great. Plus 50 to them. So now
Plus
it's
50
the
to them.
last team, team 8.
Team 8 is Kasturba Medical College, Manipal. Okay. Which
Set
are you here?
want.
Yes.
All right. Which set? 9 or 10?
9.
9. Okay. Okay. So if you are ready, Team Kasturba, we start your time now.
So wait. Yeah.
Yeah, no problem.
Yes, sir.
All right. White dot syndrome affecting young women post-viral.
Next.
Next. Okay. Most common type of congenital cataract.
Blue dot.
All right. Typical field defect in pituitary adenoma.
Bitemporal hemianopia.
Okay. Organism linked to fungal keratitis in farmers.
Next.
Next. Okay. Antibody in paraneoplastic retinopathy.
Fourth is aspergillus.
All right. We would have to stop here. First one was Mudes. What we have, the commonest type of congenital cataract is actually lamellar. Bitemporal was right. Fusarium is the most common fungus in farmers, and anti-recoverin antibody in paraneoplastic retinopathy.
So one correct and two wrong, sir. So it is.
They got bitemporal right, and we can leave the cataract. We can leave. It's all right. The fungus, they got it wrong. Yes.
Okay. So you want me to give them plus 10 and minus 5?
Yes, you can give them plus 5.
Okay. So plus 5 to them.
Yes.
Okay.
Well done.
So with this, thank you, sir. We end
All right.
with the rapid fire set also. And now it's time for the crossword set or the subspecialty round. Uma ma'am?
Yes, I'm ready.
So let's see which team. Team 1.
Okay.
Hi, ma'am.
Hi.
So which set you want?
Set 4, ma'am.
Okay.
Okay.
Okay. Are you ready?
Yes, ma'am.
Chalo. These are your 4 words. Which
Blue
anti-glaucoma
is
drug is...
keratoconus, C3R and keratoconus, Western protocol.
Okay. Okay.
One is biamatoprost.
Very good.
Toxocariasis, Dusin.
Very good.
Bluish tinge.
Last one. Last one.
Sildenafil, ma'am. Sildenafil.
Very good. All 4 right. All 4 right. Wonderful. That was.
Thank you.
And well within time. You still have so many seconds remaining. It's wonderful.
40.
Yes.
Great.
40 points. This was like...
It's lit.
Yeah.
That's
Yeah.
great. Really
That's
good.
wonderful. Just give me your phone number. I'll send you some chocolates or something after contacting you for that wonderful performance.
Thank you, ma'am. Thank you, ma'am.
Yeah. Yeah.
Okay.
Next team.
The next team is, we are through with team 3. Team 5.
Yes. Yes, team 5. Are you ready?
Ma'am, just a second. Just
Video
on
will
video.
come.
Yeah. Yes, ma'am. Good evening.
Okay.
Good evening.
Be closer to the mic, please. And which set you want?
Set 12.
Set 12. Okay. Ma'am, shall I display the questions? Uma ma'am? Uma ma'am? Just wait a second. I'll call ma'am.
That.
I'm muted.
Sorry
Yes.
for that. Yeah, I'm back. I'm back. Sorry for that.
So let's start.
Yeah,
ma'am.
shall we start?
Yes, ma'am.
Yeah. Yes. The questions are, the ultrasound B scan is based on this property of the echoes. What is that term? PISC is a keratopathy following LASIK. Complication caused by what? Immune-mediated keratitis
Marginal
prevalent at 10
Marginal.
Marginal is correct. Prominent function.
Okay. Time is up. So Uma ma'am. Okay, so the first answer is brightness. PISK, we just discussed in previous question that it is pressure. And the last one is phagocytosis. So plus 10 to them. So great. Team 5. So now let's see and now. Okay, so some technical problems, so I'll take over. So let's see which is the next team. Team 4.
Hello, ma'am.
Hello. So which set you want?
6, ma'am.
Set 6. Okay. Okay, so are you ready?
Yes, ma'am.
So here are your questions. Which cataract surgery strip uses a bent needle forceps or temporal?
Suprachoroidal space. Pie in the sky seen in
Temporal
temporal
lobe.
lobe.
Omega-3 fatty acids.
Bypass suprachoroidal space. Cataract.
Capsular X.
Yeah. Xantho.
Last one. Okay. So time is up and let's see what is the answer. It is docosahexaenoic acid. So 3 are correct. So plus 30 to you. Good.
Thank you, ma'am.
Wonderful, wonderful.
So now only 2 teams are remaining. Team 7 and team 9. So team 9.
Yes, ma'am.
Yes, ma'am.
Hi, ninjas. Which set you want?
9, ma'am.
Team 9 set 9. Okay, great. So are you ready?
Yes, ma'am.
So your time starts now. Modified benzocaterin dye used in the treatment of subfoveal CNV and ARMD.
Vortiporphyrin.
Okay, great. Sensory adaptation to avoid diplopia or visual confusion in squint. Nature of anterior capsular epithelium of the lens. The device used to classify color vision phenotypes.
Analyzer.
What? We can't hear
Photo
you.
ophthalmoscope. Photo ophthalmoscope. Anomaloscope. Anomaloscope. Anomaloscope.
Perfect,
Okay.
perfect.
Any other?
No, ma'am.
Okay. So second one is suppression and the nature of anterior capsule is cuboidal. So plus 20 to you. Good. Great. So now we are left with only one team, that is team 7 from the Jipmer Oculus experts.
Hello, ma'am.
Hello. Uma ma'am is back.
My signal is troubling me today. Yeah. Yeah. Which set?
Set 5, ma'am.
Set 5.
Okay. Okay. These are your 4 questions. The first one is, this hemorrhage is associated with pinpoint pupils.
Pontine hemorrhage.
Row. Second is a row of eyelashes. Yes. Okay. Third one.
Distichiasis.
Okay.
And,
Hallmark ID of
pars plana plaque.
Snow banking.
Snow banking.
Very
and,
good. Last one, geometric pattern in migraine. Okay. 3 right. Distichiasis is correct. Snow banking is right. Hemorrhage is pontine. And the last one is, no guesses?
Row of flashes from
Okay, what spectrum, what type of spectrum you get? Yes, that's
Fortification.
called fortification spectrum. Okay, well done. 30 points.
Okay. Sure. So with this,
So
we
was
end,
that the last? Yeah.
yes, ma'am. With this, we end with the case-based round, rapid fire round, and the or what we call it as a crossword round. So it's time for the last set of MCQs. So Dr. Deepti, welcome again.
Yes, so the last high, whatever you have scored till now, I think थोड़ा ऊपर नीचे इस round में कर सकते हो. So still aim for the best. And here's the round 3 of the MCQ. So the first question in the round 3 is, where is the lesion which produces the visual field defect which is shown in this figure? Is it right temporal lobe, right parietal lobe,
Ma'am, sorry to disturb. We got disconnected. I'm not
right
sure.
optic tract? Question is there.
Same with all the teams.
The question is there on the screen. Where
Madam,
is
the timer has started. Please go ahead.
Okay, the D, right optic nerve. So the answer is the right temporal lobe. That's basically because this is a pie in the sky and it has to be the lower part of the optic radiation, which is the Mayer's loop, which passes through the temporal lobe. If it was upper part of optic radiation, it would be pie in the floor. So with this, now the next question is.
Team, have you logged in again?
Yes, they have messaged us back.
Okay. Okay.
Which statement regarding the innervation of the extraocular muscles is false? False. Levator palpebrae is supplied by the fused central nucleus. Superior oblique is innervated by ipsilateral fourth cranial nerve. Inferior oblique is supplied by ipsilateral third cranial nerve. Superior rectus is supplied by contralateral third cranial nerve. So which is false here? So the answer here is the superior oblique is supplied by ipsilateral fourth cranial nerve. Remember, all the superiors are supplied by the contralateral part. So whether it is superior oblique, superior rectus, it is contralateral fourth nerve and contralateral third nerve nucleus. Levator is supplied by the central fused nucleus. That's why if the nuclear damage happens due to any reason, bilateral ptosis happens, and inferior oblique, obviously ipsilateral third cranial nerve nucleus. The next question. Which one of the following condition would have a positive force reduction test? Positive. So the options are myasthenia gravis, B, thyroid eye disease, C, comitant strabismus, or D, CPEO, chronic progressive external ophthalmoplegia. And the time starts now. So for having a positive force reduction test, it has to be a restrictive pathology. Myasthenia, comitant strabismus, CPEO, none of them are restrictive. The only restrictive here was thyroid eye disease. So the answer is thyroid eye disease. The next question, please. Which syndrome includes cranial nerve third palsy as well as contralateral tremors and decreased sensation? So which is the syndrome which is associated with this? The options are, is it Benedict syndrome? Is it Weber syndrome? Is it Notnagel syndrome? Or is it Tolosa-Hunt syndrome? And the time starts now. So it is Benedict syndrome. Their red nucleus is involved, and that's why it is contralateral tremors are found. If it was not Nagel, it would be cerebellar ataxia. And if it is Weber's, we all know it is cerebral peduncle, so contralateral hemiparesis. These are 100% exam questions. The next question. Which one of the following is not an example of aberrant regeneration? Which among them is not? The options are Duane's retraction syndrome, crocodile tears, superior oblique myokymia, Marcus-Gunn jaw winking phenomena, which is not. Time starts now. So the answer is superior oblique myokymia. The rest three are all aberrant regenerations. Duane's between third and sixth cranial nerve. The crocodile tears between the eyes and the mouth. And the Marcus-Gunn, again the same thing, lid and the mouth. Superior oblique myokymia is basically the extra movements which happen with superior oblique muscles. And the next question. Okay, we are done.
So thank you, Dipti. You were in the full flow. You didn't realize we were at the last question beat, but that shows your involvement into it. Great. So thank you, all the quiz masters, Dr. Uma ma'am, Dr. Annapurna, Dr. Dipti, and Dr. Rashmin for wonderfully creating this today's experience of finals of the last third season, last episode of this particular season 3. So 1 minute, sorry. So Sai, how much time would it take us to compute the results?
PP in 2 minutes and finalists in 5 minutes.
Okay, great. So till then we can request the team from His Highness also to join us on the video platform. Also request all the mentors to come live, get their video on, and all the team members to come live, get their video audio on. We will have a small chat till we are ready with the final results. Yes. Come on, everyone. Mentors also we can have. So let's play with start with team GNEC boys. GNEC boys, where are you? Come on, get your video on.
Hello, sir.
Good evening, sir. Good evening, sir. Our mentor is just reaching home from work. She'll join in some 5-10 minutes.
Okay. So any of the mentors are there with us of the 10 finalist teams? I think we see mentor Dr. Tina. Madam, please do join us with your team. Get your video on, ma'am. Good evening, ma'am. Welcome to this final episode. Your team is
Dr. Vaishnavi and Dr. Urja, team 4.
Okay, team 4 come on. Team समझना ना?
No, sir. Retinistas.
Team Retinas. Okay. Where are you?
So
Okay.
we're from.
1 minute. Till then, we also have luckily we are result ready with the private practitioner category. It is Q and Tan and Per. These 3 people, if they are on the available right now, please raise your hand. We can admit you as a panelist. We can upgrade you as a panelist. Then we can have a chat with you. Sai, can you just stop this projection for a while? 1 minute.
Q model is here.
Okay. So, Dr. Tina ma'am, how does it feel as a mentor of the team to see your team in the last 10, and what do you see their chances as? We can ask the quiz masters also to have some chat with the proud mentors.
It feels really great. They have achieved a lot, and they both are very enthusiastic. And I couldn't join for their earlier rounds, but this round, I got a little bit of. Initially, I had a little bit of network issue, but they have performed really well. They have performed really well, and I'm sure
I
they
just
will
wanted
get
to
through
find out
this.
if you're updating the file. I'm updating currently.
Yeah.
Right. Okay.
I think everyone else,
I'm doing that.
mute yourself. Request all the other people to mute besides the people whom we are chatting with. Okay. And how was it performing with the mentor on over there with you? The team members.
So it was a very nice experience, like every Wednesday, like second Wednesday, sitting for the quiz, learning new things and discussing with our mentor. And it was a very wholesome experience in total. And we've learned a lot from this quiz actually.
So how did the mentor inspire you?
It's every day. So ma'am like teaches us every day something or the other. So it's
And
not
many of
just
the-
one part, but it's a cumulative thing that has helped us. Like every day there's something new we learn from her.
Yeah,
So-
and many of the things, and even in the previous quizzes, we were able to answer because we discussed so much during our rounds or even like any time of the day.
Whenever there's a good case, like usually we discuss that in detail. So from there we
We are so proud about having a good mentors. In fact, it is the teachers. Wherever we stand today, the contribution finally is from the teachers. We have some of the best teachers as quiz masters today. Rashmin is supposed to be one of the best teachers. He happened to be one of my resident years back. So Rashmin, how does it feel? What do you see the role of a mentor in getting this team as a finalist or any other team? I mean, your
No,
comment.
first of all, let me tell you that don't trust this man who is very nice and smiling here. He was a terror as a teacher. All right, in a good sense, not like, but he will make sure that whatever that he wanted to pass on, whatever skill transfer that he wanted to do, he'll make sure that he will not stop till he was confident that we received it. And I think that's the hallmark of a mentor. He doesn't give up on a student, even if a student is not doing well, which I was not doing well for a while. So, so I think that's something which is a hallmark of a, and I can see here, a mentor and the mentee, complementing each other, and that's very rare to have this kind of combination where mentor might be enthusiastic, but mentee may not be responding to what, or a mentee would be enthusiastic, but the mentor may not be hand-holding the way we heard here.
Good. Thank you, Rashmin. I knew you would add few more calories to, or rather few kgs to my weight further. Thank you for that comment. So thank you, Dr. Urja and all. So we have other mentor with us. Thank you, Dr. Tina, for being with us.
Thank you.
Dr. Afrin.
Good evening, sir.
So you are mentoring the team?
Venetia Shreya, team number 10, sir.
Team number 10.
Yes,
You
sir.
also look almost like a senior resident.
Yeah,
Uma madam,
you-
what do you say?
Exactly. I just wanted to say that. Either she's one of the participants I never saw. So she's a mentor actually.
I have just joined as assistant professor, sir. I've like finished some 8 months of it. So I don't have that much experience as faculty, but I've tried my best to mentor my team.
Yeah.
This
We
is
can
Sarojini
make out
Devi.
that.
Yeah, they are
Yes,
from
sir, from
Sarojini.
Sarojini Devi Eye Hospital. I did my PG and SRship there, and I'm assistant professor working there itself now.
Okay.
Good.
Nice. I think being on the younger side, you can connect more with the postgraduates on their level. So
Yes,
I think
madam. It is more like three of us are hanging out like friends for a quiz together. Rather, that distance between a faculty member and mentee is not there between us. So because of that, we were able to wholly contribute as a team very nicely. And I'm immensely proud of the show they've put up right from the prelims till the finals. I hope they win.
All the best.
Well done.
Thank you.
Congratulations once more. Thank you once more, both the team members, Vanisha and Shreya, and of course their proud mentor, Afreen. You almost
Thank
look like a senior resident. Had Dr. Shilpi not confirmed that you are a senior, that you are a faculty and a mentor for this team, I would have not have accepted it. Be it. So continue
It
inspiring
is
the.
an honor to share the space with such big people as you, sir. I aspire to be more. Thank you so much.
Thank you. Thank you. So we have following this, another mentor I can see is Dr. Siddharth over there. Dr. Siddharth.
Hello, sir. Yeah.
So Siddharth, which one is your team?
Astigmate, sir.
Astigmat, sir.
Astigmat, team Astigmats.
Yes,
Just
sir.
Yes,
come
sir.
on.
From Coimbatore, Arvind Coimbatore.
So what say, how is your mentor? Can I ask you in front of everyone?
He's very cool and chilled out. He's really, he do whatever he's like. He supports us. He's very cool and chilled out.
In fact, Narendran was like a postgraduate few years back. So again, one of the young mentors. So Dr. Deepti, like our quiz master, Dr. Deepti, who is very young, we have a mentor who is as young as Dr. Deepti. What say, ma'am? How come the younger people have started mentoring, becoming quiz master at such tender age?
Sir, we
Comments
are
from
old,
either of
sir.
you.
We
Huh?
are old, but we are just looking young. But otherwise, I think what the previous mentor said, I really echo on that thought. Maybe we learn when we are mentoring them, sir. We really learn a lot when they come to us with some question or when they don't answer. Like I was a mentor till last episode. My team unfortunately couldn't come into the finale. But even today, just in the morning, my PG came to me and said me, आज मैं होता तो आप करते क्विज. He asked me this question. बोलती वो अलग बात है, अब तो नहीं है, अब तो मैं कर रही हूँ क्विज. So they really become close to us in this journey, and we develop a special bond with them. So Dr. Siddharth, I think we definitely, you have two boys under you. I'm sure you have developed a really huge bonding with them, and they were great. Astigmats, absolutely great.
Thank
They
you.
were
Thank
very
you.
focused, unlike astigmatism. They were very focused. Yeah.
Siddharth, your comments. See,
No,
it
sir.
is every year Arvind I Coimbatore hospital is churning out 2 or 3 finalists, top 10 finalists. Last 3 seasons we are seeing that. What is the basic mantra that team team Arvind follows from your center?
Yes, sir. So there are some other Dr. Chandrasekhar who has, I think, who's the chief mentor for all our teams. He has built this culture at Aravind Coimbatore. So last year, I think our team was second. I hope this year we get the first prize. And so, but it's been a great experience for me to see what the kind of questions and the enthusiasm with the participants also.
No, but I wanted to know you to share the real mantra, how you people pump in every year to 1 or 2 teams into the finals. Just share so that other people also learn from your experience.
So again, so this is again, I think Dr. Chandrasekhar sir's secret. So I think this culture also, even in the state quizzes, they seem to do very well. So yes, sir. So I think it's his mantra.
Thank you. Thank you. Thank you,
Thank you.
Dr. Narendran, Siddharth, for being with your team, standing so tall. In fact,
Thank
I
you,
believe it is the teachers like you, Dr. Everyone who stands behind the PGs at this late hour. This speaks about the commitment of the faculties from your institute. Probably that is what helps your students also to excel. So congratulations and thank you
Thank you,
once
sir.
more,
Thank
Siddharth,
you.
for being with us. Do
Thank
you
you.
have any other people with us right now? Okay, GNEC boys. GNEC boys कहाँ हो भाई?
Sir, we are here, sir.
आपका कौन है mentor इस समय?
Ma'am, Bhumika.
Dr. Bhumika, ma'am. She's
पहुंच गए madam? She's joining?
She's joining, sir.
joining, sir.
I'll just call her 1 second, sir. I'll be
We'll
back.
call her again.
Okay. Till then, can we have team Symbiotes from JIPMER? Team Symbiotes from JIPMER?
Hello, sir.
Where are you? And Dr. Kasturi madam has not come?
No, sir. Ramesh sir is our.
So Dr. Ramesh Babu, you spoke to him, you informed him or not that you are into the final? So do convey my sincere most thanks to your institute. Dr. Ramesh Babu, Kasturi ma'am, every year we have a team from you. We are very proud of you. So how was your experience? How did you come to know about this particular quiz?
So last year I participated in it with my senior. So
Okay. So that time you were a finalist?
we got third place in it.
Good, good, good. So this time what are you looking at?
Top 10.
Top 10, you are already there.
We'll be in somewhere in top 10, not the top 3.
Last year you were in top
3.
Okay, good. So congratulations. Be with us. We will be sharing the result in a short while. Okay, Team Symbiotes, Team Friends. Team Friends कहाँ से हैं? Team Friends, are they with us? I think we are missing them. Okay. Team Eye Catchers.
Yes, sir.
Hello, sir. Yes, sir. I am there, sir.
ठीक है, टीम फ्रेंड्स आ गए हैं तो उनसे पहले चर्चा कर लेते हैं.
Yes, sir.
So,
Actually, my other teammate had an emergency, so she had to leave, sir. Sorry.
no, so you are from BHU.
Yes, sir.
Okay, Annapurna ma'am, this team is from North. We have seen a lot of teams from down South. In fact, the quiz masters today were all predominantly from South and one of the young faces from North. So what's your comment? You can have a small chat with this young guy.
So, first of all, congratulations for reaching the finals.
Thank you.
And I think I have a special message, not just for you, but for all the team members that, see, though we do select a 1 and a 2 and a 3, what happens is it's not that you don't know the answers. You have to answer under pressure, number one, and under a time constraint as well. So, regardless of the final result, I think all of you should be extremely proud of yourselves, whether you're from the north, south, east, or west. Yeah, but anyway, it's very nice to see all of you here today, and congratulations.
Dr. Deepak
Questions
Mishra
were
is your...
great as well, ma'am. Each set had different sort of questions. Last year also we both participated and we came through the finals. But I guess we don't know the results as of now. But yes, thank you,
We'll
ma'am.
be sharing with you in a short while, in a very short while. So congratulations. Deepak is your mentor, na?
Yes, sir. Yes, sir.
Tell him he is missing a very good opportunity to see his students excelling. Okay.
Sure.
And of course, we are too missing him too. Okay. Thank you. Congratulations once more for being a finalist.
Thank you, sir.
So
Thank
now we have our next team, Team Eye Catchers. Team Eye Catchers.
So good evening, ma'am.
So this is team from Uma Madam's place.
Yeah. I
Yes,
must
sir.
say that in an institution which also conducts quizzes every year, we have a Yanov quiz conducted every year. For the last almost 18 years, we have been conducting. So there is some interest, and I see that Saif and Aishwarya, who have participated here under the mentorship of Dr. Rashmi, have shown a lot of difference in their day-to-day clinical classes and case presentations. They've been more active and probably inspired by the big Q. What say you, Saif and Aishwarya?
Correct, ma'am. But you and Rashmi as now has also inspired a lot. It
Yeah,
was
but
you who made us join with you.
Good. So
Yeah.
finally, every student is
Mentor is also joined, sir. Dr. Rashmi, yes.
Dr. Rashmi ma'am, please get your video on, please, ma'am. And as the team eye catcher said, finally the students are the imprints of their teachers or mentors. That is the truth of every person. Dr. Rashmi, ma'am, are you there
Rashmi
with
is
us?
there?
Hello?
Sir,
Hello?
unable to join. Video and audio, ma'am. Not able to
Okay.
join, sir.
Okay.
So I would just like to add a note on Dr. Rashmi. She is like a godmother to all the PGs. Definitely should have influenced them a lot. Yeah, all the best, both of you.
Hello, best of luck.
Yeah.
So now let's move on to the next team, Dr. Samajna from KMC Manipal. Team Samajna?
Hello, sir.
Hello,
Good
sir.
evening.
Good evening.
Yeah. So you are from KMC, and who is your proud mentor?
Vijaya Pai, ma'am.
Pai ma'am. We had an interaction with her last time. I think Rashmin, are you there with us, Rashmin?
Hi, yeah, right here.
Do you know Pai madam? Everyone knows. Every one of us knows Pai madam. She is a avid quiz master, as well as she has been following, not only inspiring the students to join our BQ every year, but previously she also used to participate at this seniority. And that is what is creditable, I believe. And that's why students like them get inspired by a teacher like Pai ma'am and are there. So you can have a small chat with this team.
Yeah, no, amazing. I know what you were saying, Dr. Prashant. Dr. Gangadhar Sundar from Singapore, he always used to say that basically what the mentors do is they transmit their intellectual gene. I mean, not the real gene. So effectively, mentor trains a student. There is a gene that the student carries, and then he passes on to the next generation, and that's how I think the mentors live on. And yeah, Team Samajna, you did very well. I remember the way you participated and the way you did was amazing. I mean, it showed that Dr. Vijay ma'am's blessings
Great.
were all shining through. Yeah.
Good. So do convey our regards to your mentor. Please do tell her that we missed her on these finals in this particular episode. Okay, Team Samajna, and best of luck.
Thank you.
So, so next is I Ninjas. Team I Ninjas.
Good evening, sir.
Good evening, sir.
So again, this is team from Arvind Eye Hospital. Dipti, see, as I said, Arvind Coimbatore, this is their second team or third team, I believe, in this finals. Who is your mentor?
Dr. Vijayavashini,
ma'am, sir.
Okay. Has she logged in?
Yes, sir, she is logged in.
Madam, please join us. Please get your video on. Hello. Okay, we are missing her. Okay.
Sir, actually, she is waiting in attendees.
She's waiting in attendees.
Sai, can you please-
Sai?
Yeah, doing it.
Please. Yeah. Could you do it? Okay, till then, GNEC boys, we will have a small chat with you. GNEC boys?
Yes, sir.
Yes, sir.
May I ask you,
Doesn't look like she can join, sir.
We have texted her. We'll inform you, sir, when ma'am joins.
Sure. Chalo, you did absolutely well. This is again second team from up north.
Sir,
Dipti ma'am.
actually, I'm from Hyderabad. He's from Karnataka. So we just
We are
studied
denying the claim of being a North Indian.
Their surnames from then I was observing also. But then they have already gained a chocolate box from Uma ma'am. I think even the ninja team, I think Rashmin sir was very impressed with them, and he said they literally were the ninjas in the rapid fire round. So these boys were really wonderful. I think for the quiz masters to give them such appreciation, you people were hats off. I think GNEC boys have met them recently also in Delhi. They are really one of the best bunch.
Thank you, ma'am. Thank you, ma'am.
So you would deny to be a North Indian now, huh? In the presence of all South Indian quiz masters. But remember, a North Indian is having the key to your prizes.
You
Just
are
pulling you.
from the central India, sir. I am one.
So don't worry, just pulling you guys. Very well played. Just hold on for a minute. We will have a small chat with the private practitioner category. We are having 3 people who participated. It's Q, Parth, or Arun. Come on, 3 of you. Tum tino to habitual. Rashmin, these 3 people have been playing with us as a quiz master, as a PGs. And now, every year now, since they have completed their post-graduation, they participate and
No, this is
all the prizes from His Highness. Especially,
I think this is the fifth or sixth quiz that Parth is winning when I'm conducting it. So I think next time I'm just going to take you as a quiz master, and even if you are around, Same with Anirudh. I mean, he and Anirudh used to participate quite often.
Exactly.
And,
Yes.
Suryanarayan ji, basically the CEO of His Highness, सर ये पूरा पैसा ये पार्थ और ये क्यू ने लेके गया है आपका, इनको क्या करें, इन बच्चों का देना है कि इनका पैसा की वापस ले ले? Yes, Suryanarayan sir, your comments.
Yes, sir. Sir, happy to be part of such a wonderful program and amazing quiz masters, amazing mentors, amazing PGs. And what we like about this Snow Doctor is like, as His Highness also is in the mode of graduation or post-graduation. We are also maturing as a company. So we are happy to handhold our fellow postgraduates in the same field of ophthalmology. So sincere thanks to you for such a wonderful opportunity. And,
Thank you.
Of course, we will be more and more happy to whatever be the winning doctor. We will be more and more happy to support every winner because that's the way we can reciprocate back to the specialty.
Thank you for your kindness.
And doctor, one more thing in the same note of what you were saying to PGs and quiz masters, His Highness also is from South, doctor.
I think I am only proving to be an odd man out with me and Shilpi there, be it. But thank you, Suryanarayan sir and His Highness team for standing so strong with us. So
Keep us a permanent part of this program. We do not want to be missing out the next thing. We are booking it now only.
Oh, thank you. That's a source relieving a news for us. Thank you. So Parth, your money will be transferred to your things by the local representatives. We have completed this particular season. We will be starting the next season in a short while, about 3 months hiatus. We will be having. We'll need to rejuvenate. We need to add some new quiz masters and some more spice to this particular program. So don't worry. Congratulations once more. So now we are ready with the finalists. Let's see the top 10 finalists, how they stand today.
You want to share the screen?
We will share the screen, please. 1 minute.
Just wait a minute.
A lot of tension now.
So we will be
tensed. Everyone is tensed.
Even we are tensed, exactly.
Yes.
So let's begin with the final. We will be starting from number 10 to onwards. We will be moving ahead. Okay. So congratulations once more to all the participants who could make it into. In fact, I would say not only this top 10 finalists, but all the people who participated are in fact the winners. Remember that. And this top 10 finalists need more special congratulations on our behalf. So let me share the screen for you. So on number 10 was today's team, I Ninjas. That was mentored by Dr. Vijayvarshini, and the students are Dr. Kotpalli Saiteja and Kaparti Chandravand. So congratulations, team I Ninjas. And number 9 is Team Symbiotes from Jipma Pondicherry, mentored by Ramesh Babu, and the participants were Arun Sahi and Kalyan Basa. Congratulations once more. On number 8 today was Team Samajna from Kasturba Medical College, Manipal, Karnataka. And their mentor was Vijay Pai, Dr. Samyak and Dr. Anjana. Congratulations. On number 7 was another team from Jipma. That is the team of Dr. Ahan and Pooja and mentored by Dr. Nirupama K. On number 6 was Eye Catchers from Enopoya Medical College, Mangalore, Karnataka. Their mentor was Rashmi. And Saifuddin and Aishwarya, congratulations on coming at number 6. On number 5 was Team Friends from Regional Institute of Ophthalmology, BHU, Varanasi, mentored by Dr. Deepak Mishra, Gaurav Pandey, and Samvida. Congratulations. And number 4 is Team Retinistas from Kasturba Medical College, Mangalore, mentored by Dr. Tina, Dr. Urja, and Dr. Vaishnavi. Congratulations. And now let's look at the number 3, that is second runner-up for today, is from Team Venetia Shreya from Sarojini Devi Eye Hospitals, Osmania Medical College, Hyderabad. Congratulations. Mentor is Dr. Afreen and the participants are Dr. Shreya and Venetia. Congratulations on being our second runner-up for today's show. Rather, today's show means the whole season. And the first runner-up is Team Astigmatis from Arvinda Hospital, Coimbatore, mentored by Dr. Siddharth and Dr. Krutin and Dr. Abhishek Nair. Congratulations. And of course, this episode, the winner of the is GNEC team mentored by Dr. Bhumika Sharma, Dr. Vinayak, and Dr. Gahan Reddy. Congratulations to all the winners. So this was the order. All the winners, let us, all quiz masters and all the mentors, let us give them a standing applause.
Congratulations.
So team number 3, how do you feel it? Team Venetia.
Sorry, yeah, we are very excited. So,
Do you believe that you
learned
make
a lot.
it into number 2?
What's that?
Is it a surreal feeling or how does it feel?
It is very unreal, sir.
Really? Do you feel you could be on number 1?
No, sir.
We
So
are
we're
happy at
extremely
what we
happy,
are.
sir. Thank you so much for organizing this and giving
Dr.
us fun and
Afreen,
challenging, sir.
Dr. Afreen, how do you feel as a mentor, your team as a second runner-up?
Sir,
For
I
the-
feel really proud of them that they have got to the top 3. And win or lose is not so important, but the journey they've gone through, the way they have prepared, and the way I have grown through this, I'm really grateful for all of that. I'm very happy for them, and I congratulate them for this win.
Good, good. Thank you. Thank you once more and sincere most congratulations. The prize money and all will be handed over. The certificates we will be mailing you shortly. The prize money will be definitely transferred by the team, His Highness. On number,
Thank you so much, sir. Thank you, ma'am.
Thank you
congratulations.
so much, sir.
The first runner-up, Team Astigmatis. How
So
do you feel, bhai?
it was great. Last year I was with Chinmay and we came first runner-up again with Siddharth sir only. So
Okay.
yeah.
So Siddharth sir is there?
Yeah.
Siddharth, your team is the first runner-up.
Yes, sir. I'm here. Yes, sir. So second time again.
Second time.
Great, great. Congratulations once more.
Yes.
Okay.
Thank you. Thank you.
And the team GNEC boys, कैसा लग रहा है भाई now?
Good, sir. Good, sir. Unexpected,
Sir, our
Unexpected
mentor
tough. That's
yeah, we did.
no, all the preliminary rounds we have been on the podium except one. So,
Fine.
sir, our mentor is also about to join.
If you just give us 2 minutes,
give
sir.
us some 2-3
Like,
minutes.
if it's okay.
okay. I'm holding on.
Thank
So
you, sir.
till then you can chat with Dr. Dipti. Dipti, a team from North has finally made it into the. There was a crowd of 10 teams. Out of that, 8 were from South, 2
Sir, we
from
are
North.
from South, sir, but
They have confessed they are from South, sir. But
Yeah.
but congratulations. I said you were good. So I'll keep up with my words. You people were really great. I think that you deserve something more than chocolate box now. I hand over it to Uma ma'am. Now I think this is something a big
Yeah.
reward which you are now deserving. But congrats, you guys were really great. We need to learn from them, sir. I think that the swiftness with which they filled the crossword, even when we were sitting and thinking, the rapid fire, the way they answered so fast, I think we should start reading, sir.
I think I have reached an age where I've grown beyond reading, I believe. I can only learn from this younger generation because I know a lot of myelin has already been deposited around my nerve fibers so that even if I try to read, it might not percolate inside. Correct? So be it. Congratulations once more. What about your mentor? Is he, are they with us?
once I'll just.
Again, at the end, I'll
Really sorry for the delay, sir.
specifically wants to thank Annapurna ma'am
Yeah.
for all the help throughout this season.
Yeah, there are, see, any team, anything, any such big event needs a lot of back-end work. In fact, Dr. Shilpi, as my co-host, has been doing and taking the brunt of it because of my slightly busy schedule, or rather lazy part of mine, whatever we can call it. And Dr. Annapurna Madam, this time really I'm sincerely thankful. Team Brain Teasers is, of course, sincerely thankful for helping her out and bailing us out at certain moments. Of course, same applies to Dipti and other quiz masters like Uma ma'am. And wherever we are in a trouble, we are short of questions, we are short of quiz masters. You all people stood behind us and helped us in completing this particular season as flawlessly. So all my sincere most thanks to all of you once more. So I think team GNEC, are we there?
They are also gone.
Yes, ma'am. Ma'am, just our mentor just joined, sir, I think.
Sai, can you upgrade them? Name of your क्या था?
Dr. Bhumika, sir.
I know in what name.
I'm just checking. She.
No, I don't see her actually.
Sai, can you see Dr. Bhumika there? Can you help us?
No, I don't see. I don't see.
Ma'am, just join on the phone, sir. Actually, I'm just checking.
But we can't see them on the panelist list.
There must be some issues. I'll just check.
No issues. No
Please,
issues.
Please.
Sorry for the delay again, sir. It's actually.
No issues. I will have a chat with her later. Thank you. Okay. So congratulations once more, all the winners. In fact, all the people who participated in this particular season, that is 320 plus teams who participated, all are winners.
Yes,
we
ma'am.
are really thankful for your participating and making this particular season as successful as in the previous seasons. My sincere most thanks to Suryanarayan sir, his team from His Highness, for being with us, standing so tall with us. And I'm really thankful to them. And of course, Sai and his team for helping us out with this whole back-end work. And my own Dr. Shilpi Narnaure, who is a co-host, who has been helping us out with this season. So it's time for us to say goodbye. We'll be taking a nap for about, say, next 3 to 4 months. And after that, we will be back with season 4 with something new, more new faces and new teams. And of course, the old quiz masters as well. So till then, it is time for us, everyone, to say bye-bye to all the postgraduates, all the mentors, Team His Highness, Team Numerotech, and all my quiz masters who participated in this particular season. Bye-bye till then. Bye-bye. Thank you once more. Thank you.
Thank you.
Thank you, sir. Thank you,
Bye.
Shilpi. Bye-bye.
Thank you, sir.
Thank you and bye.
Bye, ma'am.
Bye, ma'am.
Bye.